Okay, lifting the brows with Toxin, there are a number of things to consider in terms of how can we maximally do this using Toxin. So there's a couple of quite simple, straightforward things that you can do to really go as far as we can in terms of repositioning and specifically lifting the brows, or at least giving a more lifted appearance to how we can do that. So we're going to use yours truly here as the model for this today. So to me, it's really about avoiding treatment of the elevators, at least initially, and treating the depressors to maximize outcomes in terms of brow lifting. So first of all, treat the glabella in the way that we normally would, either a 3 or a 5 point injection. You can see in me here, I've gone for a 5 point injection this time. Then avoid treating frontalis. If we want to maximize lifting, we don't want to interrupt elevator function. Okay, so just leave frontalis alone at initial treatment if the patient's core aim is brow lifting. Then let's treat orbicularis oculi, but we're going to treat it in a slightly non-standard way. So the classic treatment of crow's feet lines, which are 3 injections in the kind of lateral portion of the eye, we're going to still do, but the couple of injections that we're going to add in are these injections you can see that are right under the brow. So kind of in this region here, because remember, you know, orbicularis oculi, the fibers of it are there as well. You know, they're in the midline above the eye. So obviously it's lying very, very superficially. So my approach to when I do this is these 2 sort of more medial injections, so immediately under almost the mid portion of the pupil and a little bit lateral to that, very superficially under the brow, and just 1 unit. I never really go any more than that because, you know, I don't want to risk causing someone a problem, given, you know, the proximity that we are here to the other muscles in and around the lid, for example, that we really don't want to have an effect on, i.e. levator palpebrae superioris and metatarsal muscle. So, you know, for me, that's my kind of go-to moves for maximally lifting the brows. So in summary, avoid the elevators, treat the depressors, and this little extra move to maximize brow lifting in terms of these more central injections just under the brow in the midline. Hope this helps.